Good afternoon. In this video, I will demonstrate how I will communicate assessment results to my client Christian using the client-centered and culturally responsive approach consistent with the assessment interpretation interview model. Christian completed a generalized anxiety disorder 7, or as known as the GAD-7, during her intake session. My goal in this feedback session is to clearly explain her results, invite her response, provide contextual meaning, and collaboratively describe the next steps. Hi, Christian. Thank you for completing the GAD-7 during our intake session. I'd like to spend some time reviewing the results together and talking about what they mean for you. I want to emphasize that this too is one piece of information. It does not define you. It doesn't capture your full experience. Instead, it helps us better understand the intensity and frequency of your anxiety symptoms that you've been describing. So the GAD-7 is a brief evidence-based screening tool that measures symptoms of generalized anxiety over the past 2 weeks. And scores range from 0 to 21. Cutoff points of 5, 10, and 15 indicate mild, moderate, or severe anxiety levels. Your score is 14, which places you in the moderate anxiety range. This score aligns closely with what you described in session, particularly the persisting worry about your son's safety, the intrusive images of worst-case scenarios, and the difficulty calming yourself even after receiving reassurance. A score in this range suggests that anxiety is occurring frequently and is strong enough to significantly impact your daily functioning. Before we go further, I'd like to pause and ask, how does hearing this sit with you? Does this description of moderate anxiety feel consistent with your experience? And it is important that we interpret these results together. I want to also normalize what this means. Moderate anxiety is very treatable, and many individuals in this range respond well to structured interventions such as cognitive behavior therapy, known as CBT, in which that focuses on identifying and restructuring anxious thought patterns, reducing catastrophic thinking, and strengthening your coping strategies. I want to also contextualize these results. Anxiety does not occur in isolation. You describe carrying much of the parenting responsibility and feeling limited support from your spouse. That chronic stress can contribute to your heightened vigilance. Initially, as an African American mother, there may be some cultural, social, and familiar expectations that influence both your sense of responsibility and how you experience and express worry. So these factors are important and will be part of your treatment plan. It's also worth noting that the GAD-7 is a reliable and valid measure, meaning it consistently and accurately catches your anxiety symptoms. However, it does not diagnose on its own. A diagnosis is made through a comprehensive clinical evaluation. This score simply gives us strong evidence that your symptoms are clinically significant and deserve attention. Another important piece is your strengths. Your anxiety is closely connected to how deeply you care about your child. You are attentive, protective, and engaged. And our goal is not to eliminate your concern as a parent, but to help reduce the intensity and the frequency of worry so it feels manageable rather than feeling overwhelmed. In terms of these next steps, I will recommend beginning evidence-based anxiety treatment. This will likely include cognitive restructuring to address catastrophic thoughts, behavioral strategies to reduce reassurance seeking patterns, and nervous system regulation skills to manage your physiological symptoms. We will also explore ways to increase support and address relational stresses contributing to your anxiety. We can use the GAD-7 to monitor your progress. Seeing measurable improvement can be reinforcing and empowering. Finally, I want to check in again. What questions do you have? What concerns come up as we talk about this? My intention is for this to be a collaborative process. You have already taken an important step, which is seeking support. With consistent work and the right tools, moderate anxiety can significantly improve. Thank you. After doing this, do you have any questions or comments or concerns that we can address right away? If so, let me know.